What is trauma-informed care for healthcare providers? Have you ever wondered how healthcare providers can better support patients who have experienced trauma? Trauma-informed care is a patient-centered approach that recognizes the widespread impact of trauma on individuals and communities. It aims to create a safe and supportive environment for those who have faced traumatic events, such as those leading to post-traumatic stress disorder and anxiety. Trauma can stem from various harmful experiences and can significantly affect a person's health and behavior. One key principle of trauma-informed care is understanding and recognition. Healthcare providers need to acknowledge how common trauma is and how it can influence a patient's ability to access and engage in care. This understanding helps providers tailor their approach to meet the unique needs of each patient. Safety and trust are also crucial components. Establishing both physical and emotional safety for patients and staff is essential. Building a trusting relationship between providers and patients enhances the effectiveness of care. When patients feel safe, they are more likely to share their experiences and engage in their treatment. Another important aspect is patient-centered care. This means that care is customized to fit the individual's needs, taking into account their cultural, ethnic, and gender identity. When patients feel valued and respected, it fosters a more positive healthcare experience. Collaboration is vital in trauma-informed care. Patients should be actively involved in their treatment planning, ensuring that their goals and preferences are taken into account. This collaborative approach empowers patients and helps them feel more in control of their care. In the context of managing PTSD and anxiety, trauma-informed care plays a particularly important role. It helps healthcare providers avoid re-traumatization by being sensitive to triggers and behaviors associated with avoidance. For instance, when addressing avoidance behaviors in PTSD, a trauma-informed approach may involve gradual exposure to feared situations in a controlled and safe environment, always prioritizing the patient's comfort and consent. Implementing trauma-informed care not only benefits patients but also supports healthcare providers. It fosters a workplace culture that acknowledges the potential for secondary trauma among staff, promoting their well-being and resilience. However, while trauma-informed care is increasingly recognized as a best practice, its implementation can be challenging. It requires significant organizational changes, including training for all staff and adjustments to policies and procedures. Despite these challenges, integrating trauma-informed care into daily practice can lead to improved patient outcomes and a more compassionate healthcare environment. By understanding and applying trauma-informed care principles, healthcare providers can create a more supportive and effective experience for patients dealing with the effects of trauma. Always remember, if you or someone you know is struggling with trauma, seeking personalized medical advice from a healthcare professional is essential.